Dr. Scott Gottlieb is here. He's a practicing physician and a resident fellow at the American Enterprise Institute. So there's Ryan getting booed. Probably most of those people saw the ad with him throwing Granny off the cliff. But the truth is, the Obama administration is trying to move a big chunk of money out of out of Medicare and into Obamacare. But these people paid for their Medicare benefits.
Well, that's right. I mean, it cuts over $700 billion out of Medicare to pay for Obamacare over the 10-year score. And what you're seeing is the rates that physicians are going to get reimbursed in the Medicare program get sanded down to Medicaid rates. Medicaid rates pay sometimes 30 cents, 20 cents on a dollar of what the service actually costs. Over time, the Medicare providers will get sanded down to the Medicaid rates, and that means they just will stop seeing Medicare patients.
Not to mention, they keep promising these efforts to make health care more affordable, but we've already seen there's so many taxes laid upon the medical device manufacturers. How do they think that they can make something more affordable by essentially making it more expensive? Those device manufacturers are either going to go out of business, roll the cost into their services, or produce less.
Well, it's a tax on revenue, too, so that means you can literally not be profitable but still get hit by the tax. And what you're seeing is in some cases the medical device manufacturers are passing a tax on in the form of higher costs. In other cases, they're not getting funded. They're moving their operations overseas to escape the tax. And we've seen that in the venture capital community, medical device companies moving overseas.
You know, one of the things before we wrap up the program, I see, and I read this in the Hill newspaper, that they're trying to move some of the funding from TRICARE into Obamacare. We're seeing the effort to move some of the funding from Medicare into Obamacare. We're seeing this sort of mashing together of Medicaid, Medicare, TRICARE, forgetting private funding for a second. When you have this massive pool of people competing for a shrinking pool of resources, and they say we're paranoid when we talk about rationing, there's only one thing that can possibly happen, and it's someone's got to lose. You can't have a system that provides for leukemia and birth control.
Well, what they're trying to do under Obamacare is get more control over providers, get more control over the doctors by consolidating them and turning them into salaried employees of hospitals and larger integrated practices. That way they can control what they do through regulation, get tighter control over the utilization. That's how they're going to bring down costs.
But what happens? I mean, how long can the losses get passed off? When these people say, well, why do I go to the hospital? Tylenol is $25. Well, that's because for the 24 other people that didn't pay their bill, and they got to roll that into the people who do pay.
Well, that's right. And what consumers are going to see is less choice. They're going to see very narrow network plans where they don't have a choice of what providers they go to, and they're going to see that their providers are subject to a lot of regulation on what they can and can't do. That won't be entirely transparent to the consumers. They won't know what their doctor isn't allowed to offer them under this plan.
You know, I read a paper from the American College of Surgeons talking about the trend in surgical tourism. It used to be from European countries and Canada into the United States, but they've noticed a pattern of American surgeons, specialists, cardiologists, and so forth, taking their practices to places like Barbados and Sri Lanka. Do we risk doctors either retiring early or taking time out of their American schedule to fly with some of their well-to-do patients to other countries where they could save on medical devices, support staff, and even facilities?
Well, you're seeing for elective procedures, doctors are moving certain elective procedures overseas. Now, the problem with all the things in Obamacare that try to sand down costs, try to bring down costs, is it decreases physician productivity. So when doctors consolidate into these integrated networks or these salaried arrangements, productivity goes down. And if you believe the only way to solve our long-term fiscal challenges is to get more health care for every dollar of GDP we spend, we're going to get less health care for every dollar of GDP we spend because productivity in the healthcare sector is going down, not up.
Now, this might be the last question. They're adding to the demand side of the ledger, but they've not added to supply. There's not one more doctor added to supply in Obamacare. So add demand, static supply. How is that going to work?
And diminish productivity of the physicians that you do have. Get ready to queue up. It's going to be harder to get access to doctors in the future.